Hi, Dr. David Lim, board certified laser dermatologist. Why do I hate Fraxel Laser for treating acne scars? First of all, I'll tell you this, conflict of interest. I'm on the Fraxel International Advisory Board. Maybe not after this video, but I am on it at this moment in time. Now look, don't get me wrong, I've got four Fraxels, right? So four different types. A Fraxel 1927, Fraxel 1550, Fraxel CO2, and also a Clear Brilliant, which is basically a mini one of these Fraxels. So I've got four Fraxels, I own four Fraxels, and I do use them. But I do not use them for acne scarring because there are other devices that work much better. There's an inherent flaw in how Fraxel delivers the energy. Now, if we look at the Fraxel repair, this is serious shit, man. This is like CO2, right? So with Fraxel repair, we're talking about a CO2 laser. And the delivery system is flawed because with this handpiece up here, we use the tip. Fraxel likes to actually build in a consumable. There is no need for a consumable for CO2. And when you can see, when we actually do the actual procedure itself, we're pulse stacking, we're actually overlaying the grids. And in my opinion, that is not good. That's really bad because it gives prolonged erythema or redness. The second thing why I don't like Fraxel repair as a CO2 for acne scarring is this. It's just not strong enough. It's 70 millijoules. I think the laser of choice, seriously, is the one from Luminous. So I reckon that's the better laser.
All Fraxel lasers, whether it be a CO2, 1515, 1927, these are all fractionated laser resurfacing devices. In other words, fractions of skin are treated, allowing untreated skin to actually heal up quicker. This is the concept of fractionation. Now, with different delivery systems, we have different power. For example, for the Fraxel system, the power is rated at 70 millijoules. And it doesn't go as deep as where the acne scars are. For example, the Ultra Pulse by Luminous goes much deeper. In fact, the treatment itself is a lot quicker. We're not actually pulse stacking. We're actually just laying grids. And like I said, it's a much better laser because it's more powerful, it's quicker, there's no consumables for the patient, which means overall it's a better experience for the patient, both when it comes to pain, time, and also a cost saving. Another good laser is made by Deka, D-E-K-A. This is an excellent laser. It's very adjustable when it comes to the parameters, and in some cases it can also pulse using radio frequency. So not only can you revise scars using a fractionated CO2, but also RF device as well. So that's made by Deka. I personally like this one here. This is the Core C-O-R-E. It's a CO2 laser made by Cineron Candela, and once again, it's extremely versatile. So I can change the treatment parameters between 1 to 5% to multiple overlaps. And the best thing as well is that it's not a rolling tip, and it has no consumables. So it means I don't actually have to pass the consumables of the tip to the patient compared to using a CO2 Fraxel laser or 1550 Fraxel laser. So remember, these lasers do not have consumables compared to Fraxel. Do I still use the Fraxel repair in the Fraxel 1550? Yes, I do. I like the actual Fraxel repair system, which is this. This is a Fraxel repair, so it's a CO2. I use it in a different mode. It's called an override mode. So basically, it's not the best for CO2 for scarring, but yes, I do use it for rejuvenation, especially around the hands, chest, and neck area. Also, it can be used for facial rejuvenation. There's no problem with that. But like I said, I use it in a different mode, and I don't like to actually do multiple overlaps with it.
Now, why don't I like the Fraxel 1550 for acne scarring? The reason being is because there are a lot of other better treatments out there. Is this laser better than not doing anything at all? The answer is yes. Is this laser better than skin rolling or microneedling, just using non-energy devices? The answer is yes. But is it a standout device or energy device for treating acne scars? And the answer is no. It's a non-ablative system. In other words, it doesn't take the top layer of the skin off. The healing time is about 4 to 5 days, which is realistically longer than what it takes for energy-based microneedling devices. So I do think that, look, it had its heyday, but it's long gone, it's long outdated. In fact, the Fraxel systems are long outdated, except for two things, except for two brilliant lasers made by them, except for the 1927, which I think is a brilliant wavelength. The wavelength is great, the energy delivery system is great, the way we perform it, we're actually inadvertently bulk heating, which is actually advantageous to the skin, obviously in the right skin type and in the right context. And the clear and brilliant, I think, is great as well, because it's a very low downtime procedure. So look, at the end of the day, one laser company, Fraxel is an umbrella, doesn't make the best devices for everything. I think they're great for skin rejuvenation, but for acne scarring, I reckon they're absolutely shit.
So this is the overview of the 1550, which is commonly used for the treatment of acne scarring. You can see, once again, it's a versatile laser in the sense that you can adjust the parameters. I think that the laser itself is too weak. There are a lot of better treatments nowadays, and I don't like using the amount of passes. It takes a lot more time, and like I said, the consumable itself is passed on to the patient, so it's not a good thing. It's really, I think that there are other better lasers out there, or other different methods to treat acne scarring. So this is me performing the Fraxel 1550. Like I said, this was probably taken about 4 or 5 years ago. I've replaced this now with other devices. Don't get me wrong, I still like my lasers. However, I do think that there is a time and place for different devices. So what are the before and afters like? Well, this is a before using a CO2. So this is a before. This is after 4 treatments of CO2 core laser. That's using the CO2 core laser and not the Fraxel. That's a realistic expectation. This gentleman has a different type of scarring. I used TCA Cross first on him to treat the deep scars. Thereafter, I used the CO2 core, and you can see this being a marked improvement of his acne scarring. And this is another example of marked atrophic together with stellate scarring and the after. Ideally, I would like to use some fillers for this, but she was happy with that. So if Fraxel for acne scars is outdated, what is the future? I do believe the future is actually not with lasers. It actually lies with microneedling devices that produce energy, such as Infinity RF. I like this over other microneedling devices because the tip of this is insulated. So you can see it in slow motion here, the delivery system. It's delivering needles or microneedling deep into the actual dermis, but the insulation of the tip is the key, because we want the actual energy device to be delivered deep into the skin rather than actually having collateral damage or damage to the upper parts of the skin. It's a very quick procedure. Yes, it hurts, but we use a numbing cream together with anesthetic. So this is the concept. This concept is really important. Fractional lasers hit the surface of the skin first. So basically, no matter what laser you're using, whether it be a CO2 and erbium laser, there's even collateral damage, in other words, damage to the epidermis, even though it's non-ablative using the Fraxel 1550 system. So all the lasers that we use have to hit the top part of the skin. This results in delayed healing. If one uses a microneedling device, such as Infinity, we put the needles deep into the skin, which means we don't treat the upper parts of the skin, but the lower parts where the scars lie. What does this mean? Well, have a look at this. So this is what I mean by microneedling causing less collateral damage to the upper surface of the skin. So this is immediately after microneedling. So I'm using the maximum setting at level 20 with 400 millisecond with 2 passes at a very, very deep depth of 3 millimeters. Thereafter going to 2 millimeters with 2 more passes at the maximum depth. So it's an amazing device. Yes, it does cause bleeding. We need to cause a little bit of bleeding because we need to actually get into the lower parts of the skin where the scars lie. But you can see the bleeding stops very quickly. Here I am using PRP or platelet-rich plasma in an over setting. So basically I use the PRP and I don't inject it. So in this situation, what I'm doing is I'm speeding up the healing time. Now the healing time, unlike lasers, is extraordinarily quick. So the patient heals up within actually a day. So within a day, the exudate, in other words, the amount of oozing diminishes markedly. And within 2 to 3 days, the skin is completely healed up. There may be some prolonged redness at the most for 4 days if I'm using a very high setting. So this is what I call a PRP mask. So PRP goes on top of the skin. There's 20,000 channels which I've created, and then the mask is saturated full of PRP, which contains growth factors, which actually heals up the recovery process. So it's a procedure which I'll be reporting on very shortly, and I'll show you the before and afters in the upcoming months. So, am I against lasers? No, absolutely not. The first thing to do is actually ask yourself, what type of scars do you have? Do you have atrophic scars, boxcar scarring, rolling scars? Because each scar patient is unique, and I actually choose the method that will give the best treatments. So do I use lasers? Absolutely. I love using erbium lasers and CO2 lasers if the scars are all in the same plane and if the scar type and skin type is appropriate. But I also use different devices such as fractional lasers. I also use Infini. I also use TCA cross and surgical subcision. So remember, it's the method and not the device. Fraxel, I think, is overrated. I'll be doing a few short clips on acne scar revision techniques, probably once a week, and these will be on video on Instagram. So if you're really bored, follow me on Instagram, and hey, thanks for subscribing, and I'll see you next Saturday. Bye.